Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an April 27th, 2022 update from the Dubuque County Public Health Incident Management Team. Even though Dubuque and the state of Iowa continue at a community level of low, the not good news is we continue to see increasing numbers of COVID-19 cases. Since the end of March, weekly 7-day case totals have been going up, from 16 on March 30th to 66 today. And those increases do not include all of the rapid at-home test kits people are doing on their own. Many of these cases are in people not previously vaccinated, and some of the cases are in those who are fully vaccinated and boosted, proving that immunity to COVID, whether it be from infection or illness or from getting the vaccine-induced immunity, wanes or decreases over time. The good news is hospitalizations and deaths continue to be very low, which demonstrates how our 63% rate of full vaccination in Dubuque County clearly protects from severe COVID illness and death. I mentioned rapid at-home tests, like the free ones you can order from the federal government or the ones you can buy at drugstores. A very important thing to keep in mind is if the test turns up positive, it definitely means you have COVID. If it turns up negative, it still could mean you're positive, but the test isn't sensitive enough to pick up the virus in your system. This is especially true if you're having COVID-19 symptoms and the test is negative. If that happens, especially if you've been exposed to someone with COVID-19, you should isolate for 5 days and do a PCR test, which is the kind you get with the free Test Iowa kit. And they're the kind you spit in a tube and send it through the UPS drop box. PCR tests can detect even a small trace amount of the virus in your system. And these free test kits are available throughout the community, including at the VNA office at 660 Iowa Street and the County Health Department office off of Seipel Road. Speaking of vaccinations and the new options for booster doses, I'm getting a lot of questions about, should I get a second booster or even a first booster? So let's sort this out together by asking a few questions. First, are you eligible? Right now, you're eligible for a second COVID-19 booster if you are 50 years of age or older and got your first booster at least 4 months ago. Or if you are moderately or severely immunocompromised and 12 years of age or older. Second question, are you or is someone you live with more likely to get very sick from COVID? So certain factors can make it more likely someone will get very sick from COVID-19, so it may be helpful to get a second booster now if you are, or someone in your household is, moderately or severely immunocompromised, or more likely to get exposed to COVID-19 through your job, where you live, or other factors such as frequent travel or large gatherings, or if you're in an area with medium to high COVID-19 community levels. Or finally, if someone you live with is unvaccinated. So final question, can you wait to get a second booster? You may want to consider waiting to get a second booster if you've had COVID-19 within the past 3 months, or you feel that getting another booster would make you not want to get one next fall, when we may need yet another booster because of the way the variant will be. Try and think through these questions in terms of your own health and lifestyle. One final bit of information from CDC, the Omicron surge infected a lot of Americans. In fact, back in December 2021, 33.5% of Americans had the presence of COVID-19 antibodies in their system. This rose to 57.7% in February 2022. That's only a few months. The jump was especially noticed in children aged 0 to 11 years, where the prevalence of the COVID antibodies increased from 44 to 75%, and likewise from 46 to 74% in those kids aged 12 to 17. So now what? All I can say is keep being safe and keeping those you live and work with safe by staying home and testing when you're sick with COVID symptoms. Stay up to date on vaccinations and be aware of what COVID is doing in your community so that you know the risk level of gathering in groups and attending events. Don't be afraid or embarrassed to wear an N95 mask. Everyone wants to get back to normal, but as science journalist Ed Young put it, normal led to this. Thanks for tuning in. Be healthy, stay safe, and think spring.